Hi, my name is Catherine Roberts Henderson, and this is a video of the initial consultation of a health screening completed on the 8th of the 8th, 21. Thank you. Hi, how are you?
Hello, nice to meet you.
Nice to meet you. Alright. So Mark, what's happening? What's going on?
Just wanted to come here for a consultation for my son Michael.
Yeah, no worries. So he's looking at getting into the gym, getting into some more exercise?
Yeah, he's doing 3 training sessions a week as part of his AFL.
Yeah.
And he wants to increase his strength and fitness, so he wants to add another session in.
Okay, no worries. All good. And how old is he at the moment?
He's 10.
Cool. And his favourite sport, I'm guessing, is AFL then?
Yes.
Yeah? Pretty intense?
Yes, he's playing at quite a competitive level. So.
Excellent.
Yeah.
That's really cool.
Yeah.
Wow. Good luck to him. That's awesome. All right. So with our consultation, we've just got some screening that I have to do first before we can let him into the gym.
Okay.
So the purpose of our exercise readiness questionnaire is to make sure that we're providing every child or young adult with the highest level of care to introduce them into physical activity. Most of the time this offers children and adolescents the opportunity to have fun, get to know their muscles, how it works, and promotes a healthy, good environment to really get into physical activity and promoting that through their childhood kind of thing. Helps to set them up for a good quality of life later on. It also encourages good eating because they can feel that their body's feeling amazing, so they want to keep that going rather than snacking on junk food where they go a bit sluggish and can't move out of that. So getting into the gym or into physical activity, as he would know because he's already doing a fair bit, just really helps to promote that. For a small number of children and adolescents, they may be at risk when participating in an exercise program. So we just want to read through, make sure we've clarified everything by completing this questionnaire. We don't miss anything underlying that may be at harm for that. And that way we can be fully informed about any conditions that he has had, either one.
Sweet.
Sounds like a plan?
Sounds good, yep.
Perfect. Now, obviously, this is all confidential information. It does not go to anybody else. It's purely just for your trainer to see where he's at.
Awesome.
And that way we can make a program based around what he likes, what's going to help him with his AFL, and with his training, what he's aiming for.
Yeah, awesome.
Cool. All right, well, let's start off with answering some questions. So, his name is Michael.
Yes.
Perfect. Alright, and same last name as you?
Markham, yep.
Yep. Right, and he's 10?
Yes, 10 years old, yep.
10 years old. And his date of birth?
So he was born on the 1st of the 8th.
Yeah.
2011.
Perfect. And he is male. I'll pop you down as his guardian.
Yes.
Yeah. Mark. Okay. And your address, please.
2 Finch Lane, Wood Rising.
Perfect. And postcode for that area?
2284.
Yep. And can I grab a mobile phone number, please?
Yep, 0434 6857 90.
Perfect. And a home number if you've got it?
Yep, 4954 8867.
Not very many people have a home phone number anymore, do they?
No.
No?
No, they don't.
a work phone number?
Yeah, so my work contact is 4945
Yep.
8876.
Excellent. Alright. Has a GP or allied health professional referred your child to this facility?
No.
No? Perfect. Alright, so we don't need the GP number. Now I've got a few medical and physical conditions that relate to children and adolescents.
Okay.
So I'm just going to ask you each one and I'll tick off yes or no as we go, and that way we can pull any of these out.
Yeah.
So has your child have or has any heart conditions?
No.
Type 1 diabetes?
Nope.
Epilepsy?
No. No.
Any breathing problems at all?
No.
No. Cystic fibrosis?
No.
Type 2 diabetes?
No.
Has he ever had a seizure or convulsion?
No.
No. Has he suffered from asthma at any time during his... No?
No, he hasn't, no.
Excellent. No asthma on the field. That's good.
Yep.
Does he suffer from a high blood pressure?
No.
No. What about high cholesterol?
No.
No. Does he suffer from an eating disorder?
No.
No. Or does he have any unexplained coughing after exercise or during exercise?
No.
No? Excellent. That's what we like to hear. No
Yeah.
to all of them?
Yeah,
Excellent.
he's very healthy.
Perfect. Is he currently taking any medication?
No, not at the moment, no.
At the moment. Excellent. Alright, so over the last 6 months, has your child had any joint or bone pain? Has he injured anything? Has he broken anything? Does he suffer from muscular pain whilst he's exercising if he's on the field for AFL all the time?
So roughly 6 months ago, he was actually diagnosed with Osgood-Schlatter disease.
Yep.
So he had some issues in his knees,
Okay.
but he underwent physiotherapy and we got full medical clearance, so he's perfectly fit and healthy again.
Perfect. So he made a full recovery then.
Yeah.
Excellent. And do you know where in his knee he had the Osgood-Schlatter disease?
So it was just below, like underneath the kneecap.
Okay, perfect. And you said you saw a physiotherapist for 6 months?
Yeah.
Yeah. Perfect. And I'll just tick that one there. Excellent. That's page 1 done. Now, does your child have any chronic disability or illnesses?
Nope.
Does he suffer from any problems or difficulty with his vision?
No.
No. What about hearing?
No.
Speech?
No.
What about his motor skills? How are they on the field?
Yeah, pretty good, yeah.
Yeah.
Yeah, he's playing at a high level, so yeah, he's
Yeah.
pretty confident with that.
And his balance?
Yeah, good. Yep.
Yeah. And how's he sleep at night time?
Yeah, pretty good.
Yeah, he's getting a good 8 hours at least?
Yeah, pretty average for a 10-year-old, yeah.
Yeah. Okay, perfect. That's good to hear. Does he have any allergies to food, medications, pollens?
Not as far as we're aware, no.
No? Cool, so no anaphylaxis?
No.
Perfect. Does your child follow a special diet at home or anything?
No, we just mainly try and keep him on the basic food groups and stuff like that.
Yeah, so
Yeah.
just nice healthy eating,
Yeah.
vegetables,
Yeah.
fruits, salads, meats.
Yeah.
Perfect. And what about his dairy? He's having enough dairy as
Yeah,
well?
yeah, it has milk and cheese and everything, yeah.
Excellent. Now, has he had surgery for any reason in the last 12 months?
No.
No. She's two. Is there any reason why your child should not participate in exercise, do you believe?
No, I don't think so, no.
No? Excellent. So you said he plays AFL
Yep.
at representative level. So you would think this is his favourite hobby or activity?
Yeah. Yeah, he loves it, yeah.
Okay.
Very serious about it.
Do you know who he plays for? Oh, I can't remember their name.
No, I can't remember the name of
That's
his name.
alright. Perfect. Alright, so in the next section, it states, I hereby acknowledge that the information provided above regarding my child's health is to the best of my knowledge correct. I will inform you immediately if there are any changes to the information provided above, and I give permission for my child to commence your exercise program.
Okay, yep.
Do you agree with that?
Absolutely, yep.
Perfect. So we'll circle I do. Consent for the instructor, trainer to conduct the performance measures below. Yeah?
Yep.
Perfect. All right. Well, I'm just going to get you to pop a signature here for me.
Oh, yep.
There. And then we'll just get you to write your name out in full as well. Thank you. Perfect. And just the date on this one.
Oh, yep.
Perfect. All right. Well, I'm going to sign now as well.
Okay, yep.
My name's just a little bit longer than yours. Perfect. All right. Now you did say to me that you would grab his height and his weight.
Yep, yep. So
Measurements?
I've grabbed his height and I've grabbed his weight.
Yep.
Yep.
And that's from today.
Yes, yep,
From
yep.
this morning.
Yep, just before the consultation, yep.
Perfect. So what were they, if you don't mind?
So we measured him at 145 centimetres.
Yep.
And on the scales, he weighed approximately 34 kilos.
34. Excellent. Just going to do some calculations over here for a second.
Oh, okay.
Just so we can calculate his BMI, and then I'll show you what that means
Right.
on the scale.
Right.
So his BMI is roughly about 6.19, which pops him in the 50th percentile. So he's at a healthy rate for his age.
Oh, okay.
So I'll show you how it works.
Yep.
So we grab the child's age, so
Yep.
he's 10,
10, yep.
and then we pop in where he's on the BMI scale, so he's 16.19, so he's around here. And then we come up to this one, and he's on the 50th percentile in there.
Oh, okay.
Yeah, so that's how we know where he's at. We like them to be sitting well under this under the 95.
Yeah,
So he's actually sitting in a bit of a perfect range in that middle section.
Mid-range, okay.
Yeah.
Great.
Sitting in a perfect spot. Really like them.
Yeah.
So I'll just write that down. All that football, keeping him in a nice healthy weight.
Yeah, that's right, yeah.
He'd run it off quick, I bet.
Yeah.
So, tomorrow when we meet up again, I'm going to run some performance tests on him,
Oh, yeah.
if that's all right.
Mhm.
So we're looking at doing the reduced copper test. So it's a running test that lasts about 6 minutes. We're going to pop some cones out and see how many laps he can do around the markers within that 6 minutes. And
Oh,
this
yeah.
will give us a bit of a gauge to his fitness level.
Okay.
And then we're going to do a muscular endurance test. So you mentioned he wants to build on his muscles.
Yes.
On
He
his...
wants to get strength.
Yeah.
Yeah.
Perfect. Well, this will help us kind of gauge where he's at, and then we can build on from there. So
Okay.
it's a push-up test. So it's on his toes, and he's going all the way down to the ground until he's got about a fist size between his chest and the ground.
Right.
And then he'll raise his body back up so this test runs until he fatigues.
Okay.
So if it takes a minute, it takes a minute. If it takes 30 seconds, it takes 30 seconds, or higher, whatever is needed.
Yeah, right.
So we just keep going until his form gives out, or until he fully fatigues and can't push up any higher.
Okay.
So that's what we'll be running. And our last test that we'll be doing is I'm just going to write these down for you so you know what they are. Our last test that we'll be running is our sit and reach test. So this is where we sit him on the floor. We've got a box that he needs to either reach onto his toes or past his toes,
Oh, yeah.
or as far down as his shins as he can. So
Yeah.
if it gets to his knees, then we need to work on a bit of flexibility there.
Yeah.
But if we can get to our toes, that's ideal.
Yeah.
Everyone's different. Everyone's fitness testing and flexibility tests are all different. As I said before, it's all confidential. It doesn't go anywhere. It stays with me. It's just so we can help him build on the things that he really wants
Okay. Awesome.
to. So we'll pop that down. Reach. Test. Now let me just double check we've covered everything for today. Perfect. Well, I think we've covered everything. Now, is there anything that you'd like to ask while you've got me?
Just in regards to his Osgood-Schlatter disease, I have some concerns that maybe furthering his exercise might re-aggravate something like that.
Look, it might. It is a disease that is brought on by overworking. But we'll work really closely with his physiotherapist if need be,
Oh, yeah.
and that way we can keep a nice close eye on it to inform that there's nowhere that he's going to worsen it.
Okay, awesome.
Yeah,
Excellent.
we will keep, now that we know about it and I know about it, we'll keep a nice close eye on it for you.
Excellent.
Yeah, no worries. Perfect. Is
Alright.
that everything for
Yep,
today?
that was everything.
Perfect. All good. So nice to meet you.
Yeah, you too.
Can't wait to meet him tomorrow.
Yep.
And see how he goes.
Okay, no worries. Thank you very
Yeah.
much for your help.
No worries. All good.
Awesome.
Thank you so
Alright,
much. I'll walk
thank
you
you.
out.